I'm Dr. Shauna Drew, and today I'm speaking with Kristina Schwalm-Bacquet, who's our mental health therapist at Drew Wellness, and she's going to talk to us about CBT, or cognitive behavioral therapy, and mindfulness. Thanks for being here.
Thanks for having me.
Great. So first, tell me, what is cognitive behavioral therapy?
So cognitive behavioral therapy, or CBT, is a psychotherapeutic form of psychotherapy that works with stress, anxiety, low mood, depression, various mental health issues. It's actually likely the most researched and well-founded psychotherapy interventions, and it's commonly understood to be as effective as medications for many of the mental health issues that we work with today. So it's a pretty well-founded intervention. Sort of the course of cognitive behavioral therapy is based on the understanding that our thoughts and beliefs are actually what provoke our difficult emotional distress. And so the beginning of an intervention with cognitive behavioral therapy would be sort of creating a nice, compassionate and non-judgmental space to begin to explore the difficult thoughts, beliefs, and emotions and behaviors that are sort of contributing to these really well-worn ways of feeling and reacting.
Great.
Does that make sense?
It does,
Okay,
yes.
good.
So what type of conditions do you work with?
So I work primarily, what I see most is usually anxiety, stress, lots and lots of high stress, low mood and depression symptoms. But you know, CBT has sort of expanded to be to respond to a multitude of various mental health issues, and I think that's largely because it really responds to this sort of universal piece about emotional experience for people, and that is that if we really begin to slow down and start to look at the thoughts and beliefs that we have on a day-to-day, moment-to-moment basis, we can start to begin to alter our emotional experience. So it runs the gamut for issues relating to stress, anxiety, as I've already spoken about, depression and low mood, but also now it has been adapted to work with this broad range of issues, from weight management to insomnia, relationship difficulties, bipolar disorder, psychosis, a whole bunch of stuff.
Wow. Okay.
Yeah.
So how does the session work? So what do you do in a session with somebody, and do you give homework? How does the follow-up go?
Yeah, okay, that's a really good question. Well, first of all, I mean, as I said before, it's really important that we really create this sort of compassionate and non-judgmental space, and a big piece of that is that right from the beginning, we're really trying to make this as collaborative as possible. So it's not so much me sort of really pushing this is what we're doing, but as sort of the two of us are really brainstorming how we're going to approach our sessions together.
Right.
Typically, what we're doing in a session is we're starting with a check-in. We're really talking about what went on this week and zooming into any of those moments or times where the emotional distress was present. And then we're starting to look at the thinking patterns and ultimately the sort of neural pathways that were playing out in each individual event where the emotional stress was really provoked and brought on. And then we're working to sort of look at those beliefs and begin to challenge them. And that same sort of process works more on in a bigger scale all the way through our sessions. Does that make sense?
Absolutely,
Yeah.
yes. And how do you bring mindfulness into your work as well?
Yeah, so I'm kind of the camp that mindfulness should be always integrated into cognitive behavioral therapy, into the process. That's because we've seen the past 10 to 20 years, mindfulness practices have really come out as being sort of a really clear and profound sort of piece in working with mental distress. And really tons of the research that was initially sort of backing mindfulness work was based in the idea of putting mindfulness practices in as an adjunct to cognitive behavioral therapy. So I see it as really inseparable to the CBT process. And the way that I'm working with it is with the recognition that CBT and mindfulness therapies really achieve something very similar in their ends. They just kind of have different routes for getting there.
Okay.
So where both mindfulness and CBT have this emphasis on starting to be able to step back from our powerful thoughts and emotions and begin to relate to them differently. we sort of learn how to be able to look at our thoughts and emotions as opposed to seeing through them. And as I say, they have sort of different routes of getting there, but I think we want to bring both of those really powerful tools in all throughout the therapeutic process. So to answer your question,
Yes.
to answer your question directly, where I typically bring in mindfulness is, again, that's about the collaboration with whatever is
Yes.
sort of whatever that person in front of me really wants in terms of the mindfulness piece. But typically it's brought in when we start to really zoom in and look at the thoughts and emotions that we're having on a moment-to-moment, day-to-day basis, and also as a really, really powerful tool to maintain the gains that have been made throughout the CBT process. At the end of therapy, we really focus on sort of provoking that mindfulness practice.
Amazing.
Ah.
Great. Thank you so much. I learned a lot
Great.
about your approach, and I'm sure everybody watching did too. All right.
Thank
Thanks
you,
again.
Shauna.